Thanks for having us here. It's an honor. I've known Bryan and Jonathan, a little bit longer, so we hope. I've got a pretty aggressive agenda, so I'll go fast. That way we confuse you, and then you have to call them for help. That's the goal, right? So anyway, thanks for having me. I hope you guys have seen that before. So, you know, why you're trying to fight with knives and when you got a person over here with artillery like that. So I hope you guys can focus and listen, and I hope we can hold your attention through this. We're part of Mitigate Partners, and it's 28 benefit consulting firms. What we tried to do here is, like, Houchens is obviously independent and owned by them. Most of these other groups across the country are all independent, but we come together and work together on cases and collaborate. So it's a little different. In the past, I'd never talked to Bryan or Jonathan. They're competitors, even though they're in Kentucky and I'm down in the deep South. I wouldn't do that. But that's what we're doing now. And a fellow in Texas and in Florida and myself won a big city in Florida that with phase one, which is that stinking tank top Jort wearing Gator team plays out of. But of all things to win, that was a good one. And just in case y'all need a wallet. I hope y'all are gonna laugh a little bit. I am funny. I mean, at least I think I am. So anyway, that's the bottom line here. And most of us are Health Rosetta certified advisors. It's like the LEED certification for a building. We've gone through some extra training, done some things, and approached things very different than a traditional broker, which we'll talk about. And we do believe that when you work in a single shop, you're very myopic in your views. You don't see the world the way we see it. We get ideas from everybody, and we pull them together. Let me block it. Are y'all gonna, if y'all take pictures, it's $100 for every snap you take. So leave $100 on the table. But if you're going to snap some pictures, I'll tell you where I think you should. This is the CEO guidebook they referenced, and we were one of the first 30 advisors in it. And this is the CEO guidebook. I'd read it. Each chapter stands on its own. So if you want to read chapter 20, it has nothing to do with the rest of the chapters. It's a great book. And then also these books by Dr. Marty McCary. If y'all ever heard of the Resident TV show, Unaccountables is where that's a takeoff of. That changed our whole benefit advising career reading that book. I'm not going to speak too much about it. And then this one is for, a geek like me. It gets deep in the weeds. Elizabeth Rosenthal used to write for New York Times. Now she's the editor of the Kaiser Family Foundation. And then lastly is David Goldhill, Catastrophic Care. Another great book. And then just a couple more. This book I'm going to be giving away to a lucky winner if they can answer the questions right and play a game with me in a little bit. We have 3 of our mitigators who have case studies in there, including yours truly. That we'll talk about in a few minutes. And it's rehumanizing health plans. Today, the health plans, benefits are done to employees, not for them. And that's what we're trying to change. And then one last one, opioid crisis wake-up call. I think y'all all know we have a real problem in this country with this. COVID has certainly made it worse, no question. And then lastly, this is a new Dave Chase book that's coming out, Relocalizing Health. And we're also featured in there on 3 case studies. My good friend Marilyn Bartlett, who changed the whole state of Montana and turned that thing upside down and put them in a $112 million surplus, and when she inherited the insurance plan for the state, it was $10 million in a hole. So unbelievable, and that's the book. So does your annual renewal meeting look like this? Healthcare costs going up, wages going down, and maybe if we don't do something magical will happen. Is anybody, y'all gonna laugh? Come on. That's my favorite song. We're not done with it. It'll come back. Y'all know the band? Pilot. They've had like one hit in 1974. So you guys need to change how you do your renewals. We got to change that. So what if it looked like this? How about this? A change will do you good. Healthcare costs going down, profits going up, and wages going up. And we're going to show you how that's possible. What is in this for you? We're going to educate and pull back the curtains to show you how this whole system was designed to cost you more, absolutely, 100% on purpose. And we're going to allow you to break free of this and do something different. Hopefully, you can walk away with some items and things to change and make a difference for your company and become an active manager of your health plan. That's going to be a theme you're going to hear about over and over from us. And then, lastly, save your company money and put more dollars in the community. We've had success with that. I tell you, some of these companies have saved, you're going to save millions and been able to put it back in the community where it is. Keep it on Main Street, not Wall Street. And y'all got a beautiful Main Street. I grew up in Macon, Georgia. I know y'all thought I was from New York, but I'm not. So I grew up in a similar thing. I love this. Is a beautiful town. All right, so key themes: build employer-built healthcare versus insurer-built. We're going to discuss this in more detail as we go. Take an active management of your spending patterns and discontinue to rely on the BUCAs. So a couple of terms I'm going to throw out at you guys. You know, our industry's notorious for all these acronyms. The BUCA is Blue Cross, United, Cigna, and Humana. Everybody good with that? Give me a thumbs up if you got that. All right, so that's what we're going to call it. So if you go BUCA, what is that? And if you're in Florida, you could say Cuba, you know. All right, that apparently wasn't funny. So it's all about relocalizing care, as Jonathan said. That's what we're really trying to get to. And then neighborhood health care, kind of the Marcus Welby MD days. And if some of you guys look awful young, I know Lincoln out here, when I brought that up to him, he didn't know what it was. It was a couple weeks ago when we met in Atlanta, and he had to Google it to find out what it was. If you don't know, go to YouTube. I grew up with that stuff. And then, you know, community-owned health care. Why don't we have Owensboro-owned health care instead of Blue Cross-owned health care? Why can't you do that? Anybody? And then this is real important. We're big community pharmacist supporters, you're going to see. Back in the day, the community pharmacist had a role in the care of the member. Now, you go, the worst thing that ever happens is a drive-through. What's your name? Nicole. You're going to be the one I'm picking a lot. Okay. Nicole loves the CVS drive-through because she can go quick and get the meds, and she may have kids at home, and it's great. She didn't even talk to a pharmacist. There's no care being given, but it's great for convenience. These community pharmacists deliver meds to homes. They do things like you've never seen, and we're going to talk about it in a second. And we've got to bring that community together, and we've got to let the local care team take care of the member without interference from all these middle people. We're going to talk about them. And again, if you do this, you should be able to break free of this status quo and do something different. And have health insurance your way and on your terms. That's what this is about. So, quote of the day, I've always said this: healthcare ain't broken, it was made this way. And y'all are looking at me, and Nicole's going, nah, it's broken. Nah. I wished I was as smart as these folks that did it this way, because they're brilliant. They made gazillions of dollars. And healthcare hasn't evolved like many other industries. It's one of my favorite slides. Anybody know what that is? Come on. I got a lot to cover here. Y'all got to help me. Yeah. First mainframe computer, 1965. Medicare was also started then. How much do you think that computer was in 1965? $29,000. How much was a family of 5 health insurance premium in 1965? $225 a year. Okay? So let's look at this. So we had a phone. We had a Palm Pilot. Any of y'all know what a Palm Pilot is? God, that's scary. Lincoln, there's no way you know what a Palm Pilot is. He must have found it in some antique show. All right. And then you got your phone and your contacts. Then we had an email. What did we get, guys? Anybody? Fruit? BlackBerry. Am I right? Am I guessing? Okay, good. I got it right. What happened to BlackBerry? They didn't evolve. And as far as I know, they're gone. Then we had the iPod, and then we had it where we added video, and then we added a touch screen. Who knows where we're going? Anybody? It's difficult. Anyone know where we're headed? So we took the most complicated, arguably the most significant human invention in the history of the world that was $29,000 and have put it in the hands of a 90-year-old grandmother for $50 to $100. Y'all want to know where health care is? That's health care. And we're gonna reference that a lot. So real quickly, the insurance companies are often called payers, and that term is really wrong, guys. Nicole, I don't know, who's the payer of the claims and premiums from your company? The employer. Yeah, the employer is. Insurance companies don't pay claims. They don't pay claims. You do. Call them the processors. Do not give them the dignity of calling them a payer. I'm supposed to be on this processor panel for the Florida County Care Organization with all the BUCAs and me. It's funny, I did it last year, but they won't let me call them. I'm not allowed to say this statement on there. They want me to keep it civil. So they are the processors. Reimbursement. My father was a 40-year OBGYN. Physicians receive payments for their services. How's my dad getting reimbursed for delivering Jonathan's baby? He performed a service. Why are we calling this reimbursements? Bad term. Provider, I hate that too. It's physicians and facilities. So, are you willing to change? And this is what we encounter all the time. Where's the ROI? And we hear that all the time, all the time. The ROI is there, folks. You have to have the courage to make a change. And that's what we're going to help you with, hopefully give you some courage. So here's one of my friends, Christy Gupton. She's one of our Mitigate partners in North Carolina. All it takes is a good advisor and a little courage. The courage is you being the courageous employer. So these stories you're going to hear in a few minutes, it's because these employers we work with are courageous. Yeah, do I feel like we're great and we did all this stuff? Sure, we're wonderful, we're unbelievable. And we're glad to speak to you right now about your plan. Now, but the point I'm making is we had to make that employer courageous. We had to have their back so when Nicole makes that decision to step out away from what she's done, she doesn't sit there and have a chance of getting fired. And it's really bad in the public sector, really bad. Oh my gosh, it's what I call 2 words, self-preservation, all the time. Be a hero, do something different, it's working. So here's the point. I say and give the employer a lot of credit, but guys, Mount Everest was once unclimbable. Now there's a litter problem on the mountain. Tons of people have done it, people still die, but tons of people have done it, and they got a litter problem. This is being done all over the country. We have 4 clients doing it. A school district tomorrow goes live with our Fair Cost Health Plan, 6,500 employees. So don't tell me it can't be done. Now I'm going to start getting fired up in a minute. So I hope I don't irritate any of you. So let's do it. You can do this. And this is healthcare. I tell you what, man, it's a rough crowd. I mean, that's a...
We don't know how to act. We've been, behind the screen. Give us a little time to warm up.
Then behind the screen...
I'm excited, are y'all? Like, to see this? I'm like...
You saying like I'm the Wizard of Oz? You said behind the screen?
No, we...
I got you. I got you. You're not used to face-to-face. I got you. All right, so that's a problem. I can't tell you my dad would come home and Nicole needs I want to get a hysterectomy, and the insurance company wouldn't allow whatever. My dad had to deal with that, and all the phone calls were taking time from him seeing patients. That doesn't have to happen. We eliminate that burden in most of our health plans, and we're going to talk about that. All right, I got to get scooting here. And don't hide behind this BUCA logo, guys. I don't know what everyone's done here, so please, but I'm being very general here, so I have no idea what each of your situations are. But you guys have given free advertising space to the BUCAs. So when the employee goes in with their ID card, it's Blue Cross. If you ask your employees who the insurance company is, and we've done that with this hospital you're going to see, they're going to say Blue. That's not right. So they've been conditioned by the insurance industry to feel this way. So this is what it ought to be. It ought to have your company logo on it. Should be your plan. All right, and this is the definition of neighborhood health care. I'll let you guys read it while I get a drink before I pass out. Jonathan, y'all got me started late, so I get a little extra time, right? Jonathan said y'all had like 4 hours. If y'all can tolerate me for that long? Okay. That's the key, guys. That's what this is about. It's about neighbors taking care of neighbors. It's about Renee being able to call you, Nicole, and work together and help people. It's not, why did it come so bureaucratic? That's not how this world used to work. My granddaddy was a general practitioner in Columbus, Georgia. They paid him with milk. What happened? By the way, I understand he was partly responsible for Blue Cross Blue Shield in Columbus. Thanks a lot, Granddad. That way they could get paid money instead of, BARDA. All right, there's a story about a hospital client of ours. I may crack up, and this is just so powerful. A group called patientrightsadvocate.org. You want to write something down? Check this out. patientrightsadvocate.org. Heard about what we were doing in the state of Florida, and they called us to come film our clients. They are the ones, and I'm not, obviously, did anybody watch that? What was that on last night for an hour and a half? Did anybody watch that? Anyway, we're nonpartisan up here at the front, so we don't. But one of the things I will tell you is all the transparency and all this executive order stuff you see about the White House is coming up with, patient rights advocates behind every bit of it. A woman by the name of Cynthia Fisher, great lady, is behind all that. They're the ones that called us to film. We did not say, come film our clients, do a testimonial. They came, This was shown to HHS Secretary Alex Azar in the White House. Another client in a minute was asked to meet the president in Orlando at the HIMSS conference. So it's kind of a big deal. So when we show you this isn't something we paid to film. Hey, I didn't say you could speak yet. All right, here we go.
We are self-funded here at this facility and have been for 30 years. Our premiums kept going up and up and up. We're a small 49-bed hospital, and we realized that we've got to do something.
When we met DeSoto Memorial, their health plan spend was about $2.2 million. We just wrapped up the first year, and the spend was around $990,000. So they saved $1.2 million, or 54%.
It's remarkable how much you can discount the price of something if you know you're going to get paid at the time of service.
What do we eliminate? The middle. We're going direct. That's how you save. It's direct to employer contracting. We negotiated a cash knee replacement price. That hospital was 70 grand. We got it for 25.
Direct primary care, where you just pay $65 a month, and that covers all of your primary care. And sort of the bundled cash payments are two prongs of things that we can do to actually reduce the cost of health care. We also have a program that's called the Medical Advocacy Program.
They walk you through the process.
It was kind of blowing my mind when they turned around and said, well, we'll do everything for you.
Getting them to the right doctor for the right quality, lastly, the right price, and at the right time. That's what this is about.
The less we have to spend on plan, the more we're able to put back into salaries, back into maybe additional benefits or increasing benefits.
As medical expense per employee per year. When we met them, it was almost $14,000 per employee per year. It's now right around $6,000.
Biopsy comes back, positive for cancer on the left side, and a week later, I was headed into surgery. As of today, all is well. I have gone through the process, an estimated cost of $42,000. What did I pay? Absolutely nothing.
And there was a lot of cost savings. So I actually got the bill 3 days ago, $31.76. An MRI is thousands of dollars. If something were to happen to me, or God forbid, one of my family members, it's covered.
The opportunity to take this model that DeSoto has can be replicated across the country in all these rural areas. Absolutely.
Not having to sit around that board table this year and say, okay, how much of the increase is going to go to the employees out of their pockets? I was giddy. I was excited that we did not have to do that this year.
And we deserve that. I know I do.
What do you think? No deductible, no copays, different things, and they saved $1.2 million. They left the buca to do that. So this has been shown a bunch of places. This was shown at the Florida Rural Health Association, unfortunately not in person. So the only people that were tuned in were people like Jonathan and Bryan. We didn't have enough hospitals. This is a real problem in America, guys. 450 hospitals are threatening to close. Georgia's lost 8. We need to band together. We are rebuilding that community. That's the 4th poorest county in the state of Florida. You're going to see that in a minute. So this has been featured August the 14th. It's also, we stuck? Okay. It was also shown at the Texas legislature back in January. We were up there that's the head of HHS for the state of Texas right there. So we were up there, that was shown. We were talking about ways to fix this. And it was also shown in a deer stand. November 2nd, last year, it's 36 degrees, and I got it done in 10 minutes. So it was in a deer stand that day, and unfortunately, I didn't see any deer. It was a little loud. And then the parent, gosh, y'all are a tough crowd, jeez. And then it was shown at the nuts and bolts. That's direct primary care. Does anybody know what DPC is? Raise your hand. I'm going to cover that in a few minutes, where I'll help you guys. Yeah, of course, Lincoln knows. So we're going to cover that. So it's been all over. It's been on podcasts and stuff. We're glad to get you links. So very quickly, they have 157 employees, folks. 157 save $1.2 million, or 54%. So don't tell me you can't do this. Here's a little bit about them real quick. 4th poorest county in Florida. They lost obstetrics in February of 18. The members have to drive 1 hour to have a baby now because they couldn't afford it. Couldn't afford it. They're a disproportionate share hospital. It means a big percentage of their population is Medicaid. Their foreign medical spend, they had 79% of their dollars going away from their hospital. So of their employees that work there, 79% of the claims dollars were going to other places. Why? Because I can tell you why. We'll get to that in a minute. Because the deductibles were the same no matter where they went. And so I don't want Dr. Burgess seeing me naked in my own hospital, you know. I mean, that's what happens in these small communities. I get it. So anyway, here are the results. Their stop loss, have you ever heard of stop loss insurance? They saved $150,000 in their stop loss premiums because of our fair cost plan. We'll talk about it later. They weaponized their plan design and trying to become their own PBM, pharmacy benefit manager, or other term program bilking millions. So they're trying, and that was apparently not good either. Program bilking millions, okay. So we're going to talk about that, and then they implemented direct primary care, which I'm going to cover in a minute. Hired the first full-time surgeon in county history with the amount of money that was saved. And their foreign medical spend went to 62% because we took the deductible away, and there are people who worked there for 30 years and never gotten care in their own hospital. By the way, it's a 4-star CMS hospital. There's like 19 in the state of Florida. It goes to 5. That's pretty remarkable. It's a great hospital. And again, you already saw the savings. And they got a rate decrease on their stop loss premiums, second ever rate decrease in the history of this insurance company. So it's kind of a big deal. All right, any questions? For 3 months, we had to stay with the BUCA, and they're obviously self-funded. We had to stay with the BUCA for 3 months from October to December. And then we moved to the fair cost plan January 1. Look at the difference, guys. 3 months with the BUCA, 7 months on our platform. Is everybody following that? Over 2 times more was spent in 3 months. I mean, in 7 months than 3. Not even 2 times. And that's kind of the spend. And then lastly, y'all already saw this. I'll move fast through that. So the current state of health insurance is, you know, the matrix. Warren Buffett's thoughts, y'all ever seen this? GM's not a automobile company. It's a health and benefits company with an auto company attached. And it's the tapeworm of the American economy. I'm sure many of y'all have heard that before. It's a real problem. Also, as he likes to say, pretty smart fella. And that's what we're here going to share with y'all, hopefully, if I can get to it. So what's the bottom line? That's the equation, guys. It's that simple. That's how you're trying to figure out what your health insurance spend is a year. That's exactly how it works. And a lot of the brokers out there and the employers have focused on the wrong 20%. They come out and they talk about what we call the fixed cost, and that's all they talk about. Hey, what's your per employee per month administrative fee, Mr. Employer or Mr. Broker? It's all about that number. But guys, where's all the money being spent? In claims. So that's what you want to do, and that's your variable cost. So we focus a lot of time there. We can save in the fixed cost, but we can really make some hay in the variable. And that's where you need to spend your time. That's how you make a difference in your health plan. Don't focus on the fixed cost. Our fixed costs are higher than most plans because we have solutions in there that bring your variable costs down. So, and this is something coming, guys. Gap, that store in the mall, the CFO and the HR have been sued. You can Google it and look it up because some of the members' premiums kept going up, benefits got worse. I don't know, but I mean, some child, some girl, I think, I don't remember the whole story about a girl. They got a bill and they have a daughter and they got charged for circumcision on a girl. It's interesting. So anyway, those are the kind of things that you're seeing out there. So you've got to watch this, and this is the funny part. The DOL's all over these financial advisors about 401k plans while they're just tripping over bags of money in health care. So just remember, ignorance is not a defense. And I'm not here threatening any of you guys, but I'm telling you right now, as benefits get worse and worse and premiums go up and up, people are getting wind of this. It's out there in the public a lot more all the time. Be careful. Don't be one of those ones. And unless you live in the state of Florida, orange ain't a good color. And it ain't a good color down there either. So anyway, all right. So these are the 2 benchmarks that matter. If I was to meet Nicole, I'd say, Nicole, Carl, you run your mouth too much. You know, what's your bottom line, man? What do you got? What's your medical expense per employer per year, and what's your prescription drug expense per member per month? I hadn't met an employer that could tell me that yet. Not without having to go research it. Our clients know what that number is because that's the only number that matters. Everything we do to help an employee or your plan reduces those numbers. So that's really the only benchmark. I know y'all want to say, well, we're an employer in Owensboro and the average deductible for a company our size is beep, 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 and all this stuff. That's great. This is where it really hits, where the rubber hits the road. So, do you know what your benchmarks costs are? Here's the national average, $12,125. Where's your organization? And this is where we generally range, somewhere in here. And you're going to see a client's less than that in a minute. Guys, you got 200 employees, do the math on that. What does that mean to you? And then lastly, prescription drug expense. National average is 100. This is where we generally range. Do the math on that. A lot of money at stake, guys. All right. So I'm going to talk to y'all about a house. I got to move fast because I'm getting way behind here. We did this for the SHRM a couple of weeks ago, and an hour and 15 minutes, so I got to move. All right. Let's talk about a house. Let's talk about a house in the way of a health plan. Think about a house. This is what we run into mostly, is a traditionally passive managed plan. It's easy. It's off the shelf. You buy it from the insurance company. We call it BUCA Insure Built. We used these terms earlier. Now you're going to see them come to light. It's great. It's easy. And hey, Carl, this is complicated. I don't want to do all this stuff. It's too much. How's that working out for you? I assume that's why you're here. So we were frustrated with what the BUCAs were doing. We were frustrated with what the TPAs were doing, third-party administrators. So we created our own model to make the existing one obsolete. That's what we did because we were tired of it. So perception is everything. That person up on the left, is that 3 or 4 boards? Person on the right, are they looking at you, or are you getting a side profile view? Down on the left, is that 2 vases or 2 people? And on the right, we don't like elephants either because we're not big Alabama people here. At least I'm not. I know there's a couple of them. Always is. Do y'all have any teeth? No. I know, that's good, wasn't it? You like that? That's good. We don't have that problem at Georgia. I mean, not at all. All right, so perception's everything. So in defense of you guys, I'm not here attacking you, but that's the perception because of all y'all have ever seen and heard. So Nicole's running a business. She doesn't have time to delve in this stuff every day like we do. So the perception is reality. So what we say is, that's Nicole's plan. And we're going to talk about Mr. Potato Head, and if you don't know who that is, you can Google that too. I don't even think my kids ever had a Mr. Potato Head. But it's an insure-built plan, and it looks great, but it's passively managed, and it's easy. Now, our perception, because we have a different perception, it's time to hit the panic button. That's not a real good look at Mr. Potato Head, okay? You've got to do something about that. So what we try to do is deconstruct and unbundle the whole system, brick by brick, and more of an actively managed platform so that you could get a human patient-centric plan, putting the patient in the middle, okay? And, maybe you don't like Captain America, but the bottom line is, if y'all are following this, I hope, it's an employer-built plan. It's your plan. So if you don't like that, maybe you want Wonder Woman, Mr. Potato Head, or Homer Simpson, Mr. Potato Head. But you ought to get a choice, not what they give you. You're going to tell me, Carl, it's not really insure-built. We pick our deductible. But they got all the solutions in there that help the cost go up. So anyway, you need to focus and get to an employer-built plan. And that's what we're going to spend really all this time talking about here in just a second. I know you're like, yeah, you're going to have a start. Why you should build? A lot of us rent before we buy. We all know the advantages of home ownership, right? Insurance companies build your plans and then allow you access to them. If you're fully insured, they're charging you a network access fee in your premiums to your own plan. And they tell you how to do it. And they don't pay for care. We've covered this. Employees do. And a homeowner, and when they build a home, have input into their house and what it is. And sometimes they buy a spec house, but they still allowed to pick appliances and things sometimes. And not everybody enjoys building a home or have done it, wouldn't do it again. We're here to help you do that. We've already taken care of that for you. But that's the bottom line. You get to pick the tools, the lumber, the faucets, the doorknobs. It's your choice, and the bricks. You should have that choice with your health plan, okay? So this is what we talk about. This is what we think works. We deconstructed and rebuilt it brick by brick and brought all the best bricks. We found the bricks for you, and we've done that so we can help you build it. And I know you're like, this looks complicated. It's built. That's what our fair cost plan does. That's what the DeSoto Memorial Hospital has. So it's a custom-built, actively managed health plan, built brick by brick. Right now, if you're working with an insurance company, you got a few of those bricks. You ain't got many of them because they don't make money with all these bricks. It saves you money, which in turn costs them money. All right, so we call it employer built, and that was our fair cost plan. Any questions so far? What's most important, Nicole, all your employees need to know where the front door is. That's it. One call, that's all. They don't need to know where the plumbing and the electrical is and what doorknobs you picked. That's what the employees see on the front. The behind the scenes of building, we met with DeSoto, and it was about 1 o'clock in the afternoon on October 1st of 18 to 6, building their plan together with them and all our partners as we built it. If you hadn't got that amount of time, it doesn't have to take that, but I think the results speak for themselves. So that's what we want you to know. The employee is not complicated to them. All right, so what does your plan look like? I'm partial to the silver britches on the left and the red door, my team. But you might like the modern home on the right. Maybe you want the mansion in the middle. It's your plan, so make that choice. You should decide that. And this is an example of our plan. I'm going to fire it out. If you look on the left, that's what we've done with some groups. On the right is kind of what's happening in America, these medium-sized companies. A lot of zeros. Is that a hard one for everybody to see? There's $0 copays. CT scans for no cost. Now, I know what you're going to say. The insurance companies told us if you do things like that, people can go get CT scans every day. Do you think that's really going to happen, folks? Don't buy into that. All right, specialist copays. You hadn't seen copays like that in 30 years. This plan dials the clock back. Outpatient, inpatient copays, coinsurance, et cetera, and $4,500, $9,500 out of pocket. You'd have to go have 30 surgeries to make it out of pocket on our plan. And then that's what they charge for dental and vision also. That's a pretty good deal. Nice, rich plan. Encourages people to take care of themselves. And again, the benchmarks, this is the hotel client of ours you're going to see in a minute. That's where their benchmarks are, 185 employees. Any questions? So this is one more piece on Hannah real quick. I want you to hear what she says and what her plan is meant to her. And she says in there, these benefits are for us. And she also says, I was scared to death to use my health plan before because of my deductible, my out-of-pocket. I mean, most of these hospitals, I don't know if the Owensboro health people are here, but a lot of these hospitals only collect 7% of that deductible and coinsurance money. What if you went and talked to Owensboro Health and said, hey, look, we've got a really cool plan. Can we talk and work out a direct contract with you because we're not going to leave you holding the bag? Our employees, you want to chase them around for money. Because I can tell you right now, most Americans don't have $500 in their checking account.
Well, the benefits that we have here at the hospital are more so focused on the employees. The latter part of August, I had a concern regarding my neck, and I went in to see my primary care. Listened to my concerns, and he recommended certain protocols. It was my choice of what I wanted to do. You would think with the specialist, the appointments are so far out. Within maybe 3 weeks from seeing my primary care, having my test done, getting my results, finding out that I need to have a biopsy done. Biopsy comes back, positive for cancer on the left side, and a week later, I was headed into surgery. As of today, all is well. I have gone through the process, an estimated cost of $42,000. What did I pay? Absolutely nothing. So before, I was paying all that money on my premium, and I never used the plan because I was reluctant. Because if I have this copay, I'm going to have this deductible. We don't have those issues. Every concern I've had since day one of this plan, I have addressed and have taken care of this year. And I've paid absolutely nothing out of pocket. And we deserve that. I know I do.
All right. So it's a journey, guys. You don't have to fly. A lot of our groups we've met, they start flying out of the gate. You may want to do it in piecemeal. You can be met where you are. But the key is you've got to know what flying looks like. If you don't know what flying looks like, how can you make a decision? And the problem in our industry is these things, they're called brokers. There's a difference between a broker and an advisor. Brokers get paid commissions, bring in carriers together and so forth. Brokers, I'm not saying they don't work hard but there are a lot of them out there that just, outside of shopping the market every year for you, there's not a whole lot of value. We actively manage these plans with our clients. You're going to hear story examples here in a minute. But to be able to do that, and we all put our fees at risk sometimes as a percent of savings. I should have wished I'd done it at the hospital. Anyway, any questions so far? Real quick, anybody Seinfeld people? So what can George teach about healthcare? I always say this to everybody. Whatever your broker tells you to do the opposite. Okay? Y'all remember this episode? He was at the cafe and he said, my life's never, everything I've ever, my intuition's been wrong all the time. Maybe if I do the opposite, it'll work. He goes up and says, I'm unemployed and I live at home with my parents. And she says, have a seat. So, that's what this is about. So why are we charging diabetics for test strips? They don't have the money. And if they don't regulate their A1C, they end up in the ER. And then they end up in an inpatient admit. It's not complicated, folks. Do the opposite. We don't charge, our clients don't pay. And we generally partner with a community pharmacist where we have them sit down with the member once a month for 15 minutes, and that community pharmacist will synchronize their meds for them in a bag, and they walk out with everything. That's how you keep them well, and they're happy about it. All right, so the path forward, y'all got to answer this question. You want to stay passive or go active? Which one? If you want, because we're done, depending on how you answer it. Anybody? Nobody? You want me to shut up? All right, we'll go active then. Here we go. All right, so real quick, y'all already covered this. Everybody's got misaligned interest in this whole game. That's part of the problem with it. And we do believe the traditional brokerage community supports these models because a lot of them, like Jonathan and Bryan, went and saw a different path. They heard about it and they went and saw it because they were tired of meeting with you and delivering these increases, and they got a raise and your employees got worse benefits. So that people can seek ways out. That's why we partner with a lot of people. So we do call that the cartel. That's my favorite word. I can't believe it hasn't come out of my mouth yet. And employees, it's not their fault. They're conditioned in this system. And trend, who's had an increase on their insurance premiums labeled trend? Anybody ever heard of trend? No such thing as trend. I'm going to prove that to you in a few minutes. Absolutely no such thing. And the richer plans equal less claims. I think we just proved that, didn't we? And relocalized care, build community health plans. So, and that's the way it was when it worked. So our hope and commitment is we've studied this thing for the last 7 years and identified the 6 flaws in the system and turned them into opportunities for you. And I got to move. And by using the data analytics, we can help you actively manage your risk, and we'll improve the employee experience in the process. So here are the flaws: the cartel, the lack of pricing transparency, billing errors, traditional PPO discount game, pharmaceutical sale, and lack of information and data. I'm going to try to go through each one of those with you a little bit, quick. The good news is before you put the hose in the exhaust pipe and shut the garage, there's hope. That's why we call it the ultimate hope, 6 opportunities. You absolutely can do something about that. And if you solve all those, our hotel clients save they save 68% over 3 years. So they're getting 80 times the benefits for 32% of the cost. You're going to see that in a minute. And even though I screwed up in the video telling them how much the savings was, I don't know what happened. I don't drink coffee, so it must have been dead. All right, so the cartel. No one wants the premiums to go down except you guys. Everyone else at the table, I don't want them to go down. Why? They don't make money. And I'm not going to, if I was cashing these checks monthly, I don't know how bad I'm going to feel about that. And that's kind of what's happened. Remember, it's on purpose. That's healthcare in America. And I want to be real clear. We're not here to bash any particular industries, but guys, this is how it looks. Look out the conference room window and see the names on the buildings. It's a real problem. And who's on your side of the table? This is the Fortune 500. I'll lose it here normally. This is just crazy. This is the one everybody always takes pictures of. Did y'all know where those companies ranked? Anybody have any idea? I bet the employers didn't. United Healthcare owns their own PBM. Optum. Isn't it interesting? Cigna merged with Express Scripts. And that and CVS merged. I don't know how the DOJ allowed that. I really have no idea. United had already built their own, and we're going to cover that. And by the way, Optum, United Healthcare owns 636 companies. Optum owns 292. Optum owns over 50,000 doctors in this country, more than anybody, more than Kaiser Permanente. They secured a $50 billion government contract a few years ago. And watch their commercials during the golf tournament, and y'all all tell me what they do. Because it's this abstract whatever, I don't know, I mean, other than print money. It's a real problem. By the way, and I can say this in this group, I'm not allowed to do it during the, that's who that hospital was using before we met them. That's who they had. Strange enough, they had an independent third-party administrator that was owned by United Healthcare, and Optum was the PBM. All right, so anyway, that's a big deal. And what's funny, look where the companies that make the drugs are. All the middle people, we're going to get to in a minute, the ones that are the in-betweens. So anyway, that ought to be alarming. So this is a the school district we work with. I just want you to see this, their salaries. This is the problem and what the family health cost was. And 10 years later, look at what it was. This is happening all over America. How can that continue? So the interesting part was, that was the stock price 10 years ago. And while all our employees are getting beat up over the head, paying more, getting less benefits. So, for your entertainment. All right, everybody catch that? You saw them, they were 65 on that slide before. And in May, they jumped to 13. You ought to be enraged. That just ticks me off so bad. Here's stock prices of all the others. And the multiples are huge. I'm not going to waste time on it. So who's advocating for you guys? That's y'all. Hospitals, insurance companies. And again, I'm not trying to make the hospitals or any of them out evil. I'm not. I'm just stating the insurance company, the middle people, are controlling it. And it's mostly the insurance companies that's in the middle of all this stuff causing the ruckus. And there's your broker yelling at people. I don't know how much good that's doing. So anyway, who's your advocate? So this is what we're faced with. And I will tell you guys right now, that story does not end like the movie does for you guys. That's what we're up against. All right, so the solution, eliminate the middles. All you got to do. It's real. Not somebody goes, Carl, what do you do? Just eliminate the middles. It's not hard. We build the plan. So real quick, first block we're going to talk about is value-based direct primary care. That's the one opportunity you have. And real quick, direct primary care is really the Marcus Welby MD Day. So very quickly, like for DeSoto Memorial, Dr. Lee Groves, who actually brought us to the hospital, and that's how we got him as a client. He's a direct primary care doctor. He's at the White House, I don't know, every other month at least, was there a lot on the healthcare steering committees. You pay them $65 a month for Nicole, her husband, $65, and the kids, $25, and next kids are $10. It's a direct subscription model with the physician, and they can spend hours with you. There's no fight to see them, and we have employers that are fronting that cost, as DeSoto's done. And I got to tell you, that's a big reason their costs went way down. Because what it does, my dad practiced in the system. Dr. Gross used to be a physician that was fee for service. So the more they did, the more they got paid. Our CFO client at the hotel, you're going to hear from in a minute, he used to go to Dr. Gross when Dr. Gross was in a different model. They quit going because all they ever did was refer them to specialists. You would be shocked if you saw the amount of ER visits and the amount of specialist visits on a DPC model. It drops like a rock. And that's a better cost for you. They're actually taking care of patients because they can. I'm not making these doctors out to be evil out there, guys, but they can't take care of people because they got to see 50 to make money to cover their overhead. Go to these DPC practices, they don't have all these employees running around. They don't have insurance. My dad had 5 people doing insurance work at his office with 5 partners, obstetrics, gynecology. 5 people doing insurance. All right, so, how's that working out for you? I mean, why are we insuring these low frequency, low cost events? Why are we buying insurance for them? You don't need to. Direct primary care covers it. All right, and then this is just, we had a member on Percocet for 15 years. I mean, I don't even think you can sit up and do this talk on Percocet. But we've had these kind of things happening, and they had a meeting with a member, got the spouse to come in, had to come to Jesus meeting, and they got the member off the Percocet and fired the pain doctor. Somebody was on the brink of suicide at 4:30 on a Friday afternoon. They talked them off the ledge, fixed them, got them there. That's the kind of stuff you can do with good care. And it is your relationship, not because they're in Blue Cross's network. Totally not that way. You can get on their schedule. You don't have to wait 8 months. All right, everybody good? This is a book we're going to give somebody when I play a game here in a second. I'm going to give this book away. This is a friend of ours, Dr. Purcell, wrote it, and we were featured in there. I wrote a foreword and some other things. So anyway, and Christy Gupton contributed. Y'all heard her quote earlier. But that's a great book, and I'm going to, like I said, I'm going to give it to you, and I can give you the links. Jonathan and Bryan can. It's a short read, and it's great. Every employer, there's some great lessons in there. How an employer works, how a broker works. I mean, that was a lot of the things we were helping them with. Dr. Shane Purcell, he's in Anderson, South Carolina. All right, lack of pricing transparency. All right. Whew, y'all good? I'm out of breath. All right. Cost and quality guidance navigation. Critical part. As y'all know, where in America do we go out and do we buy a car without knowing the price? So you go to the hospital, you go to the physician, you go wherever, you don't know the cost for 30 days. I mean, what is wrong with that? Why are we still doing this? So let's look at it. What if we bought groceries the way we buy health care?
There are no prices on anything here.
Oh, believe me, some of it's pretty spendy. Whoa, that's really gone up.
Stop. I don't need both. Just one or the other. It depends on the price.
Oh, that's called shopping. We don't do that here. Thank you for coming in. Your bill? Your version will be mailed to you in 30 days. Good luck trying to make some sense of it.
Now, I'm highly offended that y'all laughed at that. That's the one thing I don't want you to laugh at. Why are y'all doing that to your employees? I mean, it's not really funny. I mean, that's what you're doing. Why? Our clients don't work like that. That hospital DeSoto doesn't work like that. So I'm going to help you with that. Y'all are okay. I'm not mad at you. Y'all can settle down. All right. So what does your network do right now to help the person find the best provider? What do? It's like throwing darts, the wheel of misfortune. That's what happens, and the hospitals work off of charge master pricing and things, and that's where a lot of this starts. We'll get into that a little bit later. But that's the deal, and it's like the Price is Right. It's all over the gamut. It's everywhere. We're going to talk about examples in a minute. So that's the problem. That's what's happened. And again, the charge master, our client DeSoto, literally Vince, the CEO, pulled out their charge master. That's where their pricing is. And I'm not kidding when I tell you this. It's a true story. It was back when we first get known. He pulls it out because we're trying to work on a bundled price for a knee replacement to bring it down there and do it at their facility. And that, by the way, they did it for $18,840, which is really good. He had to blow the dust off the book. Everything is, the insurance companies negotiate off charge masters, and a lot of the charge masters don't have any basis to their prices because we have access to data where we can see what a cost in a hospital system is of their, of knee replacements, things like that. You can see that in what their cost to charge ratios are. So anyway, that's the bottom line. The third-party payer, once Nicole's employees blown through their out-of-pocket maximum, they don't care. So then they go over here for $200,000 when they could have come here for 20. Problem was they didn't know it was 20 here. So they went over here, and that's the point. All right, so that's a problem. So how do we get them to care? Price equals quality, not in healthcare, and I apologize, guys, that when we moved the presentation over, this computer messed up, but price equals quality. So here is, what do Owensboro employees go for hip and knee replacements? That's where the employee lives. These are the quality scores on the right. The higher the quality score, the better outcomes, et cetera. I just want to show this to you. I'm going to kind of fly through this. Look at the prices. Why is that cheaper over there? So the real struggle is, how do we get that employee to get there? How are they going to find out, and how do we get them to go there? And we're going to talk about that. But they deserve the right to know. And if you're trusting the insurance company's website to help you figure out those prices, then we probably shouldn't talk anymore today. All right, because again, the higher the cost, it benefits the insurance company. All right, and then this is a diagnostic colonoscopy, just another similar example. I want you to also, one thing I did bad at, look at the number of procedures done. I apologize, I missed that back there. That's how many they do at Owensboro. So they're pretty good at it. They're good at it, right? Those are the kind of things that are important. So how many procedures they do is really important. Sometimes the ones that do the least are more expensive. Again, how do we get that employee to go there? Okay? So that's the data that our clients have available, their employees do with this solution we're going to talk about. And again, they know about the provider costs and differentials, and they stand by and passively pay these ridiculous differentials over and over with your money. So that's what I'm going to show you. So what if we brought healthcare the way we buy groceries? That's what we're going to show you. So this is what we've got. We have access to CMS and commercial databases. We've got the cost and procedure. As I said, everything's reported to CMS on an annual basis. What Medicare pays, what the hospital bills are by codes, and we have a nurse advocate that helps and identifies quality advisors. And you're going to hear me say this 20 times. In order to gauge employees, plan design's got to reward good decisions. That's important. I'm going to cover that in a minute. Here's how it works. You've got a nurse. I think the two most trusted people in America, I think, were like doctors, nurses. I know the firefighters and things like that as well, the police department, the civil workers, and also CPAs, I guess. So it's run by nurses, and everyone calls in. And again, we're going to talk about it in just a second in more detail, but the plan design's got to reward the good decisions. So right now, all those doctors are in your network. Nicole, they're all in your network here. So how do we get the people to pick B over I? Physician I is a friend of yours, Nicole. He's great. They're a great person, but they're Dr. Hodad. That's hands of death and destruction. Not real good. Huh? Apparently not funny either. And how are you going to find Dr. B? That's what this solution we're showing you can help you find out. So here's a great example in St. Petersburg, Florida. This is knee replacements. There were 60 doctors that could do knee replacements. Then we looked at the outcomes, the procedures. We looked at doctors that did 50 a year, because they do 50 a year, they're pretty good at it. And then we looked at the quality, then the cost of the implants. 4 fell out of the funnel. How are your members going to pick those 4 doctors? How are they doing that? And then this particular doctor had 4.47 deaths on the table doing knee replacements. So, it'd be nice to know that before you went. Still don't know how you have half a death. I don't really understand that. But anyway. All right, and then this is the hospitals. This particular hospital did 1 knee replacement for $161,000. This one did 538. So again, that's the information. Your members don't get that granular. They get recommendations from this service that our partner we use. All right. And then the data is available. Like I said, you got to get in the hands of the consumer. Nurse navigators do it. We are big believers in cash. And I will tell you, a lot of the hospitals, a lot of the physicians, they are as well, because it takes them a while to get paid. And with COVID and everything else, it's put a strain on people. So here's an example, and the plan design's got to award better decisions. So this is what we've been able to do. This is a hospital in Florida. They charge $37,500 for a vaginal birth. My dad about fell out of his chair. We got a cash price for $6,500. And the member got 50% of the savings from what the plan was supposed to pay, and that number up to $1,000. So they got that back in their pocket too. Pretty cool. So you get them buying in, and I will tell you, any elective or pre-certed procedure, we're always trying to achieve a cash price with the facility, and the team we have involved is. So weaponize the plan design. So what we would normally do, we would say this: if you do not call the cost and quality company, Miss Employee, then we're going to penalize you $1,000 for any pre-certed or elective procedure. You don't have to do that, but I'm just telling you from experience, when you don't put the penalty there, it doesn't work as well. Whatever you want the penalty to be, I want it to be penal. So all they got to do is make the call. So Nicole calls, hey, I'm calling, I'm good, no penalty, right? Yeah, no problem. So Nicole says, the nurse says, you need to go see Dr. Schuessler, and Nicole says, I want to go see Dr. Burgess. So Nicole's plan is going to pay like it always pays. She doesn't have to, she can go wherever she wants once she makes the call. But if she follows the advice, that might be the outcome. That's how you get people's attention, guys, with their wallets, and it works. Prove it over and over. And this is a story of having what we call a benefits champion position that was created. So we have not a payroll person, not an HR person, because how much money this hotel has saved, they have their own employee that's the benefits champion. They come to her for everything, and she helps maneuver and help people, direct them to all these parties, etc. You don't have to do it, but boy, I tell you, it's a home run. Gotta go.
In itself is people are kind, and the people actually care about each other, and they go out of their way to make you feel welcome as an employee, as a guest.
With the benefits at the end is brought forward us, especially with healthcare, has been, a welcome change from what was before and what I've seen in other companies as well.
The fact that everything is so hidden in healthcare across the board, and hospitals are the same way. How much does it cost? Nothing in America is sold that way other than healthcare.
Being here for 25 years at the end, we've seen many different insurance programs come through. So when they decided to go self-insured, I didn't really know what that meant exactly and how that was going to go for us. For the last 4 years and coming to understand the insurance, absolutely, I hope we can keep it forever. It seems to work out well for both the employee and the company.
It certainly has. I think it does align with our core values, being that we're, family owned and we operate as a family.
Coming here and becoming a part of the family and receiving this type of offer meant so much to me.
We went and found and deconstructed the whole system and found the best components and brought 16 plus solutions together and seamlessly integrated them into this fair cost health plan that we've created. All of these years, the savings is probably around 1.6 million, somewhere in that range. What do we eliminate? The middle. We're going direct. That's how you save. It's direct and employer contract.
The benefits coordinator, in our case it's Liz, who's great, and she's always extremely helpful.
Having someone that you can call any moment of the day and say, hey, I have this issue. Help me.
I am here and available to them 24 hours a day, even on the weekends, and to guide them if they have any questions about where to go, who to see, how to handle their plan.
Being that everything's transparent, there's a clear line of communication.
We can help redirect people to good care and good pricing.
We have a partnership with a local radiological facility, and because of the rates that they have agreed to, our members pay absolutely nothing.
How much money have I saved? Maybe little $5,000 for me and my family. That means a down payment for a home.
We're saving probably between $5,000 and $10,000 a year as a family. That's the difference between a few mortgage payments or college savings for my son.
Try to get the employees to understand it's a collective thing. Something we bought you to go use it or don't use it. It's our health care. If we all approach it correctly, we all have to pay less money out.
So that's Liz, the benefits champion I was talking about, and that's what she does. There's not a really overly expensive position, but it's an important position. And I got to tell you, that's a big deal, guys. That money's being put back in the community they're saving. It was going to Wall Street. Now it's staying on Main Street. Only 185 employees. It's $1.8 million if they stayed fully insured with United Healthcare versus being self-insured, self-funded. But the real number is if we had self-funded with United Healthcare based on their claims they had. The claims last year, there were over $6 million for 185 people, guys. Florida's most expensive health care in the country. The savings is about $3.8 million when you compare self-funded to self-funded with fair costs. So anyway. All right, so billing errors, very quickly. This has been a tough and touchy situation. We call it medical bill review. But I want to talk about this, and I don't have time for this video, but all the ladies always get the year this was shot because they know hairstyles. The men don't have a clue, like I don't. I know when it is because it's my presentation, but she shows on there toothbrushes for $1,000, being charged for 41 IV bags for an hour stay in the ER when there's only one used. You can imagine all that, so I'm not going to play it. Very, very conservative news station as well. And so anyway, it was 2010 this was shot. Still going on 10 years later. All right, I won't bore you with that. So, unfortunately, in October 15, this is what happened. Do y'all know about this? We went from ICD-9s to ICD-10, 17,000 to 140,000 codes. Nothing wrong with that. What a great idea. That's the problem. So the hospitals, everybody's struggling. My dad, I mean, the stuff they had to deal with is crazy. All these modifiers. So of course there are going to be mistakes. How could there not be? So the U.S. General Accounting Office, our government, estimates that their overcharges on 99% of all hospital bills. Again, not their fault. It's just so complicated. And then they have to have revenue optimizations companies work for them to make sure it's just very complicated. And then there's a national study Equifax did, 97% wrong. Services never provided, quantity of services not done in accurate numbers, bundling, unbundling. So here's the bottom line. Would you pay this bill? So if Nicole and I had a lunch meeting and we went to lunch, Nicole's going to get this, we're going to get this itemized bill. We're going to put our credit card down, make sure it's right, then we're going to get our summary bill. That's not how this works, guys. The facilities are sending that summary bill to your insurance company or third-party administrator with no itemized statements, period. Over and over, over and over, see it all the time. So here's an example of somebody pretty near and dear to my heart. It's my wife. On August the 6th, 2016, she had to go into emergency room. We had to have some issues. And anyway, we thought it was a gallbladder thing. We were looking at actually getting it removed. Turns out she had to have a laparoscopic appendectomy. So we go in. This is the UB04 I was just talking about. This is the summary bill that the insurance companies get. Everything in yellow is wrong on that bill. Now, you might say, Carl, God, man, you do these presentations all over the country. How come you don't have a better copy? That's the best copy I could get. It took us 3 weeks. They didn't want to give it to us. So I had our partner that we work with in our health plans review it. That was the bill, which is pretty high for laparoscopic appendectomy, but we'll get to that later. So we got the itemized bill and we started looking at it, and here was no problem. OR operating rooms work in 15-minute increments, so she was charged $5,650 for an hour-long surgery. No problem with that. But then we got charged for a urine qualitative, $206. That's the early pregnancy test. Could have gone down to the cartel pharmacy for that, $8. But you know, they don't let you do that. When you, hey, I want to go down here and do this, that wouldn't work. I want to go down and get a CT scan somewhere else. You can't do it once you're in. So anyway, oxygen, $90, and the premium stapler to pop those holes back, $1,360. Problem is, it's necessary and integral to the procedures. So it's built in here and they unbundled. Okay, so in certain places like this particular hospital, it's pretty common, about 40% of the bills are usually wrong. And again, I don't think it's on purpose, it's just how it goes with all these codes. So, this is my favorite. We got charged $957 for an observation room that she never was in. I don't know if we had a view of downtown Atlanta or a dumpster. I have no idea because we never were in it. And that was the bill. The true and accurate bill should have been 19. There were $10,694 of billing errors. Remember, they're paying discounts off the total. If you reduce the total and they pay their discount, we'll get to that in a minute. So, remember when I said healthcare has not evolved like other things? Look at a delivery in 1943, how simple it was. I think a lot of hospitals would rather have it that way too. A lot of physicians would too. I know my dad would. This is a $227,000 knee replacement. There were 16 titanium screws used for $97,000. I don't think you can buy those at Ace. They're special. We got the itemized bill. There were only 4 screws used. Save the client $55,000. This is happening, guys, all the time. And the part about it is, remember, at some point it's going to come back and rest upon you guys. All it's going to take is one of those, and it's happening. So that's that. And what we do is a lot of these BUCAs struggle with you putting these solutions in. We fought very difficultly with the school district on this to do it, but review it, break that link, pick a claims level you want to review above, and have it reviewed. It's going to generate 17 to 25% of savings. Like that, your members will never see any disruption at all. All done behind the scenes. Real simple. All right, so that help you? All right, real quick, traditional PPO discount game. Talk about that real quick. It's about defined benefit, and I got to scoot. I got to go. I'm past my time now. We have a system that's got top-down pricing. Does anybody know what top-down pricing is? Anybody? When you buy a car, Lincoln, how does that work? When you go to the dealership, you got a price from Kelly's Blue Book. They got their price. If they don't come down, you walk, right? Well, the insurance company's already determined your pricing. It's top-down pricing. So, Nicole, I'm going to play a game when you give you a chance to get this book. What's your favorite store to shop at? Hey, I'm running out of time. You got to go.
How about their Macy's? Let's do Macy's.
Okay, all right. Well, you don't know this. One of my cousins was one of the founders of Macy's, way down the line. So I don't know why I'm standing here talking to y'all, but and of course they're not doing well right now financially, are they? I've got a deal for you. I'm going to offer you 50% off at Macy's the rest of your life. One stipulation: you can't review your bill. Would you take that deal?
No.
Why?
Because 50% off depends on.
And you nailed it. Here you go. Y'all give her a round of applause, guys. Discount off of what? The starting price is all that matters. It's irrelevant. So if the price is $200,000 over here at Schuessler Hospital and it's 30 over here and they only got a 20% discount and they got 50 over here, what's better? Don't play that game. Anyone that walks in your office and starts talking about network discounts, kick them out. A waste of the discussions. And I will tell you, the hospitals would much rather work direct with people. I know this because we've negotiated with very large hospital systems that would rather work with an employer and do things like that because they want to get out of that game. And we pay them on the spot. All right, so anyway, now I'm getting jacked up again. I was a little, so no correlation costs and services. And the PPOs are working so well, the costs have gone up 4 times over 25 years. All right, anybody ever heard of this Stephen Brill, The Bitter Pill? Longest article in History Time magazine. It says it all. If you need that, we give you links to that too. This is a hospital in Atlanta, Georgia. That's what the hospital bill charged for a CT scan without contrast. That's the file that they say it cost them to do it. Medicare pays them about 4 times that. Medicare is accepted all over America, everywhere. And that's the average reimbursement that they get by the insurance carriers. Anybody ever heard of Adam Ruins Healthcare? Has anybody ever seen that video? I need to send that to y'all. It's great. It's really funny. But this is the bucca per scan at one of our clients. That's how much they were paying, and that's how much fair cost paid. So, problem. All right. So real quick, this is the state of Florida. Remember we talked about medical trend? This is really, really important. So if you're bored, who's bored? You want me to get out of here? Let me go jump in the river? All right. Here's the deal. I'm going to fire this out. This is the length of stay, average Medicare payment, and the actual charges from the commercial insurance carriers. This is all the plans in the state of Florida over 10 years. All of them. Look at the chart. Watch the number on the far right. How's that discount working out for you? That's your trend increase. Guys, you know how much that trend increase is from 29 to 57? 100%. That's why you're getting a trend increase. The advances in technology and all this other stuff in medicine, really? Why did the length of stay go from 3.93 to 4.3 days? People staying almost a whole day longer because things have improved? All right, and this is Medicare trend. No such thing as trend. Don't buy it. 11.2 over 10 years. Don't buy it. You're getting popped 6 to 10% on medical trend, and you're feeling good about it. Hey, we really did hard for you this year, and Nicole, gosh, we got it at 8%. Why? That's not good. Is that good for your company, having to jack all your unit costs for all your goods and services? All right, and where we're going, we don't need networks. We don't need ID cards. We got a whole different way of doing it. That was supposed to be funny, apparently not. All right. I am struggling today. We better do better tomorrow. All right. So this is a solution that we proposed here. All of you employers should be going and talking to the hospitals and taking your combined buying power and shopping hospitals, not letting an insurance company do it because I think we've proven they're not real good at it because it benefits them. That's what you do. We've done this. You don't have to be 6,500 employees to do this. We've got people nipping at wanting to get in our plan like crazy. And as you build it in a community, it builds momentum. You get 3, 4 employers, and then it changes the whole game. And all the money can stay local. So real quick, like I said, let the hospitals compete. CalPERS, anybody know what CalPERS is? California Public Employees Retirement System, largest health plan in America. I think 1.3 million lives. In 2011, they studied their hip and knee replacements. We've kind of covered this. 30,000 to 200 grand, and they were getting killed. And they said, enough of this. We're going to dictate the rules. We're going to pay you, Burgess Memorial Hospital, $30,000 for every hip and knee, period. They got 49 hospitals to agree. And over the course of the year, all the other hospitals over time lowered the prices to have the chance to take care of their members to make money. That can be done. You don't have to be CalPERS to do it. We're doing it with groups much smaller. That's how it needs to work. That's defined benefit pricing. And we help you with that with our design build program. Then create your own network. It's not really a network. You own it. It's Nicole Built Healthcare. It's your company plan. You should own that. And that's what we allow our clients to do. And then again, find a good hospital. Owensboro is a great hospital here. Find you an anchor hospital and try to build your plan around it and steerage to that as long as the quality lines up for different procedures. And that's how you do it. And when they go other hospitals, our programs right now, our employees on our plans can go anywhere in America. I guarantee none of y'all's plan. Anywhere in America they can go. Plans accepted everywhere. They can go anywhere in America for any procedure. Mayo, Cleveland, they can go. It may be a deductible or a little bit more cost, but it won't break the bank like most health plans do. They have that choice. And then we like direct contracts because there's no balance billing issues. It's easy. And some of you are fully insured or your plans with these BUCAs are getting balanced bills. People are getting balanced billed even in that environment. So we can eliminate that. And then again, you do imaging, lab, DME. That school district's going to save about $1.8 million on their imaging cost, circumventing around one of the BUCAs. $1.8 million, like that. All right, know how to network, and then you save money because there are network access fees built in. You can save that money. All right, and real quick, that's a fractured radius on the top, fractured humerus on the bottom. Those are the bill charges that came from the facility to my client. That's the hotel. The BUCA would have been 30% off, 50% off, pick your poison, whatever the discount. That's what we paid. So if you want to talk about discounts, how about 89%? So that's what's possible, and then this is really the truth. I'll let y'all read it, and I'm almost done. I'm about to wrap it. Only thing in America we buy this way. Doesn't have to be like that. All right, pharmaceutical shell game. I got to go quick because I'm running everybody's time. Let's talk about RX optimization. So it's a shell game. It's a black box. That's you, that's the member, and that's how the pills get to them. And as y'all probably noticed, I ain't real smart. A lot of money changing. It seems pretty complicated to me. All right. And then again, there's so much abuse going on. It's unregulated. I know that Trump, they came out with executive order, transparency, all that stuff will be tied up in court for years. That's why we can't rely on the government. We have to do it one employer at a time. You guys got to take control. You guys have to take health care back. It ain't going to happen from D.C. Number one advertised drug in 16 was Humira. We spent all our money on research and development. Really? $344 million on advertising? Anybody ever seen Humira advertised before? All right. And then, again, all the money and lobbying, I didn't even cover that. Avastin, I hope nobody knows what Avastin is, or Avastin, I mean. Cancer drug, $6,000 for it. Duke Medical charges $23,000. On and on and on. So anyway, and everybody focuses on rebates. What's my rebates? Forget rebates, guys. Pay less for the drug up front. It's a game. That's another game they play. All right, and I got to go. We use pharmacy consultants because they know more than we do. I showed y'all this earlier. Here are all the parties, just so you see. Merck and Pfizer, they're the three wholesalers. They're the middle people getting the drugs to the pharmacies. They're in the top 20, Fortune 500. And there goes some more top 20s. Guys, this healthcare thing, isn't it a beast? All right, so 5 buckets. Get away from traditional PBM Use a pharmacy benefit manager. That's who your pharmacy plan is with, guys. This is a pass-through company, and we eliminate spread. You'll save about $170 per 500 employees. Not hard. Preferred, non-preferred. Y'all have heard of in and out of network PPOs? What about taking care of a community pharmacy, guys, and putting them at a $15 to $20 less copay than we put a cartel pharmacy? CVS, Rite Aid, Walgreens. Why not do that here? But they can still go, but they're going to pay $15, $20 more. Publix, Kroger's, they're all in the preferred, and you'll save that on average. And the reason I'm showing that, Jonathan was down at our Mitigate Partners Summit back in June. He came down. He got to meet this pharmacist. This pharmacist delivers twice. That's the hotel y'all saw. They deliver twice daily to the hotel. Twice. So the members have these HIPAA-compliant bags. They just go up front and they pick their medicine up. They don't even have to go get it. Pretty cool, isn't it? That's what you can do when you build your plan yourself. That's what's possible. All right, and spread pricing. Anybody know what that is? Very quickly, I'm going to go fast. That's what's allowed by the PBM. And then when they bill your plan, pharmacy gets paid $225. The member pays $10. They take that. They charge you that, and that's their spread. That's their profit they make on your plan, and it's happening all the time. So you got to get rid of that. Specialty drugs, special programs out there, we can get these things cut way down. That muscular for a child is englycemia, I can't pronounce it. It's $2 million, the most expensive drug ever. Pray you don't have anybody that gets on that. And the savings could be way more than that. Depends on how many specialty drugs. And this, don't cover Duexis and Mavovo. I mean, this is what it is. There's 80 equivalents of these. Remove them. But a lot of the PBMs with the insurance companies include them because they get paid more money. You've got to pick those drugs and get rid of them. There's 80 equivalents. All right, and then we do 90-day retail, not mail order. Mail order is the biggest scam out there. Do not do it. You have to get it filled at a preferred pharmacy, and it works like a charm. Remember, that's grocery stores, independent community pharmacists. It could be Walmart, Costco, depending. That's how you do it. And trust me, it works, and you'll save that much a script, minimum. There are a lot of scripts being in your groups, All right, and that's the results. So here's an example. We met somebody. Nicole's plan was at $135 per member per month. Nicole, what? That's one of the most two important benchmarks, right? If we got 600 employees down to the national average, we'd save them $529,000. We got them to fair cost, that's what they'd save. And that's with no disruption, no pain to your members at all. All right, lastly, lack of information data. Geez, okay. This is a problem, okay? This is my favorite. Y'all already know all this. So I had a prospect in a really small, poor county in Florida I was talking to. They had found out they had 10 diabetics in a group of 150 employees. I said, well, that's great. That's great, Dawn. What did Florida Blue offer you? Well, they're going to give us posters and stuff to put in the break room. That ought to work. And no laughter again, geez. Okay, all right. So the point I'm getting at is, in our model, we know who the people are. You can't find that out in most of these programs. Including our school district client, we never could find out who the people were. We never could. They won't even give us that. It's over 6,000 lives. You should have access to all of that. The HIPAA officers in the company should. And then we work together to fix it. I'm going to cover it real quick. So, demystifying and actionable intelligence. This is what most of these insurance companies operate on Yellow Pages when they ought to be on a more Google platform. And that's why you don't get good data. Our data analyst that we employ in our programs, he handles 32,000 members. This is what we've discovered over the years. Y'all probably heard of this. Top 10% of your members drive 73% of your cost. And you know that. And I bet you got all these beautiful reports on your corner of your desk that have all these beautiful colors and all this stuff. And I can't even afford a toner to print those beautiful reports for y'all. So, and I'll go in there and say, well, what'd you do with that, Nicole? We don't know, nothing. You find out the top 10, but can you do anything about it? That's how we save the hospital all the money. The diabetics got glucometers that are read 3 times a day, Bluetooth enabled 365, 24/7. A nurse is involved. If they don't check in, they're calling them like a bill collector. That's how you do it to help it. And these members are happy about it because they're in good health. They're staying healthy. All right, and the rest of the people don't spend much money. Jonathan talked about that earlier in his intro remarks. You can say, I know it's hard to read, but don't worry about them. So we manage 27 conditions usually and track them, rank them. Again, I've heard all this before. I'm sure you guys have, but we're actually doing it. It's different. And that's what we try to do. So those are the conditions tracked. And then this is a case study. This is the hospital, guys. So very quick, Jonathan, you heard this in April when you came down to Tampa in 2019. 66 people through BUCA reports, 2 years of BUCA reports, guys. This hospital doesn't hire a fire. It stays the same. It isn't like, a big city where everyone's wanting to move there. It stays pretty static. They identified 66 people I'm going to show you with these chronic conditions over 2 years, 66. Remember I told you there were 3 months on the BUCA platform and moved to ours in January 19? 3 months on our platform, we identified another 31 people with these conditions that the BUCAs never did. That is huge. So quickly, here's the levels of management. Lifestyle people were less than 5 claims. Active disease, 5 to 10. And then lastly, the chronic. This is the ones we want to watch. So these people we can keep here or go back. These people we might revert back, but we don't want them to go here. But this is the programs we put in place to help manage them. That's important, guys. And also, that particular hospital did have an opioid problem. That's how much we could save them with opioids. They decided not to pursue. That's one of the few things they didn't do we told them to do. Dr. Lee Gross and Dr. Crouch managed that case, and we reran the opioid report. There's hardly any with a direct primary care doctor taking care of them. It's significant. All right, and then this is the granular data look. This is a large cancer claim review. This was a $206,000 claim. This is the granular look I'm talking about. There were 700 units of that chemo used. Nicole, how much does someone have to weigh to take 700 units of that chemo? 7,000 pounds. Would have been paid in the BUCA environment. All right, and I'm not going to do this. Jonathan, can I do this real quick? Quick? All right. Bonus round real quick. I'm over now by about 15 minutes, but this is significant, guys. I'm going to tell you a true story. With our school client, back in March, we had a $3.2 million heart transplant claim that came in, negotiated with the discount, $2.2 million. What a bargain. The stop loss for that school district is at $900,000. So that cost the school district $900,000. The first we heard of it was in March. In our model, when that call comes in, our utilization management company gets it, calls me, our cost and quality company, our network development partner, our client, and our third-party administrator. And we are resolving those things right there on the spot. We would have been able to do that heart transplant for $184,000. There's no utilization management being done, guys. None. They may deny things here and there on medical necessity, but they're letting stuff go through there. That's the problem. You can't be an active manager of your plan. We see it over and over. We get these notes from them, and the person goes, here's your large claimant report for today with an exclamation mark, like we're excited about it. Every week we get these things, and there's nothing we can do. That's not how this model works. So real quick, this is just a breakdown of it. I mean, it works like this. All the members call in when they get a pre-cert or a elective procedure. It goes through all these channels. I'm not going to go through it, but it's pretty complicated. That's how it works behind the scenes. So again, it's a journey. What do you want to do? So in summary, you can tell we're about actively manage a plan. And if an employer doesn't want to actively manage their plan, they're probably not somebody we can help. If you got somebody taking good care of you and they're doing the broker dance every year and shopping your rates, stay with it if you like it. But active management is where it's at. And that keeps you from getting to the deer stand on a Friday at 5, and it keeps you off the golf course because I'm still helping people, getting involved, getting deals done all the time, trying to help members with all our parties. I'm like the conductor of an orchestra with this thing we've created. And your population health managers, don't hire a broker. It's a population health manager. That's what you need to hire. Forget brokers. They're selling insurance. I think you can see we're doing something different. And again, y'all, we're big data fans, but we actually get data we can do something with. And I will tell you the data that's fed over right now on one of our clients from the BUCA that's going live tomorrow, it's terrible. I just proved that to you. All right. So again, build employer-built health care. Know what your benchmarks are. Employers are doing it all over. It is possible. I hope you guys have a hope and are leaving with good hope that it can be fixed. And it all takes good advice and a little courage. You know, let these guys Uber your health plan before it gets Kodak'd. Rough. All right, thanks for your time. I'm sorry to go over. Any questions? If we have time. I don't think we do because I went way over.